my name is Liz. I'm going to be your nurse for today. What's your name?
I'm Erica Wisniewski.
Erica, awesome. And what's your date of birth?
May 15th, 1996.
Well, it's so nice to meet you, Erica. Can I just see this? Perfect. Well, it's really nice to meet you. I'm just going to wash my hands before we begin. So today, I'm here for a genital urinal assessment. So I want to talk with you about some things, and they might be awkward to talk about, but I want you to try and answer them as fully and honestly as you can. It's completely confidential between you and me, and it's just for really your benefit. So first,
the nurse is going to start by asking the patient some questions.
Okay, so first of all, have you ever had any children before?
I have not.
You have not? Are you sexually active?
I am not.
You're not sexually active. Okay. Do you have any STIs, STDs?
I do not.
No. Okay, well, good. When was the last time that you had your period? Have you hit your
Yes.
menstrual cycle yet?
It was 2 weeks ago.
2 weeks ago. Is it regular?
Yes.
Okay. And any heavy bleeding irregularities?
No.
No. Okay. Awesome. Well, okay. Well, that's awesome. Also, another thing is, do you have any problems urinating?
No, I do not.
Any pain? Any irritation?
No.
Okay. How many times a day do you go to the restroom?
I would say 5 to 7 times.
5 to 7 times. So you're pretty hydrated?
Yes, I like to stay hydrated.
Okay, do you ever know, that's great. Do you ever notice that there's a certain smell when after you urinate?
Nothing unusual.
Nothing unusual, okay. And what color is it?
Pretty light yellow to clear.
Light yellow? Okay, well perfect. That shows that you're hydrated. So congrats on that, that's amazing.
Thank you.
And it's very important to stay hydrated. Another thing is, do you ever feel yourself not being able to empty your bladder fully, or also ever feeling like after you go to the bathroom you still have to go but you can't?
I do not.
No, okay, well that's awesome. Do you ever have to get up at night to go to the bathroom?
I do not.
Okay, well great. Sounds like everything checks out pretty well.
So another thing that the nurse really wants to pay attention to when dealing with women's health are breast exams. Because breast cancer is growing. So they want to be sure to ask the patient if they're doing a self-breast exam, and they want to explain this to them by telling them to place a pillow under their right shoulder and right arm behind their head, and by using their left hand, move the pads of your fingers around your right breast gently in small circular motions, covering the entire breast area and armpit. Use light, medium, and firm pressure. And you want to do this for both breasts, and do this about 4 to 7 days after your menstrual cycle ends, in order to know any changes in them.
Oh, you're here for your pap smear today. So just letting you know what that is, you're just going to check your cervical cells for any type of cancer, just as a preventative measure.
Gotcha.
Okay, well awesome.
Thank you.
Yeah, you're welcome. It was so nice meeting you.
Nice to meet you too.
Thank you. Okay, so now we're going to do a genital urinary assessment. And so it's kind of awkward to talk about, but it's definitely something that needs to be talked about. So I understand if you feel a little awkward, but try and be as open and honest with me as possible. I mean, it's confidentiality in here, and it's really for your benefit that you tell me all these things, so we can get the most accurate diagnosis and assessment as possible, okay? Okay, awesome.
The first thing the nurse is going to do is ask the patient some questions.
Okay, so have you had any swelling, pain with your testicles?
Nope.
No? Okay, well that's great. Has anything been abnormal with your testicles that you've noticed lately?
No, I don't think so.
No? Okay, well that's really good. When you go to urinate, do you have any pain when you go?
No.
How often do you urinate a day?
5 times a day.
5 times a day? Okay, so do you drink a lot of water?
I try to.
Okay, that's good. Definitely you need to be hydrated because you're an athlete. Drinking a lot of water. Also, what color is your urine when it does come out?
Yellow.
Yellow. Okay, so that's showing that you're kind of dehydrated. Our goal is to have you clear. or something that's pretty close to clear, okay?
Gotcha.
Awesome. Do you have any pain or like burning?
Nope.
No, okay, good. And what does it smell like? I know it's a kind of weird question, but it is really important.
It smells like regular pee to me.
Okay, so nothing abnormal?
Nope.
Okay, well good. Also, do you have any like blood in your urine or anything abnormal like that?
Nope.
No? Okay, perfect. Another thing I have to ask you, are you sexually active?
I am not.
You're not? Okay, so have you ever been sexually active?
Nope.
No, okay, so no STIs or anything that we have to worry about?
Nope.
Pretty much there, or any worry about, have you ever, if you were sexually active, do you know about safe sex?
Yes, I do.
Okay, well good. Well, great.
Okay, and the nurse, if she wants, can give the patient a pamphlet on doing self-testicular exams, because those are very important in preventing disease. So the instructions are to hold the penis out of the way and check one testicle at a time. Hold the testicle between your thumbs and fingers of both hands and roll it gently between the fingers. Look and feel for any hard lumps or smooth rounded bumps, or any change in the size, shape, or consistency. The patient should notice if there are any changes because they should be doing the self-exam once a month. Thing the nurse is going to do is inspect the skin for color, vascularity, striae, scars, and if there are any lesions. The next thing the nurse is going to do is auscultate in each of the 4 quadrants of the abdomen. She's going to start by warming up her stethoscope with her hands so that it's not uncomfortable to the patient. The nurse should start in the right lower quadrant. She should listen for the number of bowel sounds and count how many are present. There should be between 5 and 30 normal bowel sounds. The next thing the nurse is going to do is percuss in each of 4 quadrants, and they should sound tympanic because air rises to the surface when the patient is supine. She's also going to percuss at the liver. Next, the nurse is going to use palpation. She's going to start with light palpation and note any tenderness, enlarged organs, or masses. Next, the nurse is going to use deep palpation. And again is going to note any tenderness, enlarged organs, or masses that she finds. The last thing the nurse is going to do is wash her hands.
Okay, well you can put your shirt down, and now it's time to talk about your balls.
Wait, let me start this scale first.
And in this pamphlet, the patient is going to find information that says
Yeah. Come in.
Okay, so we're gonna start. Hi. Can you repeat that? So first, I'm just going to inspect. I see that you're very muscular defined.
I need to narrate. Otherwise, I don't have a part in the thing.